Good morning, everybody. I'm Scott Bicklin, and sitting in for Megan Cullup this morning because she is not here. She has left me unsupervised to do our local information program for COVID-19. So bear with me, but I'm glad that you are with us, and Megan will be joining us again on Monday for the program. So never fear, she'll be back. But it is Thursday, August the 27th here, and I think we're at week 24, if I remember correctly, from Monday's program. So we're glad that you are with us. We've got some great information to share this morning. Jamie Church from the Farmington Chamber of Commerce is going to be one of my guests this morning. And then Dr. Erin Philpott from San Juan Regional Medical Center. We'll be talking with her about some of the new treatment news we are hearing about COVID-19 and much, much more coming up this morning. So stay right where you are. We're glad that you are with us. We're going to go to the phones to talk with my first guest, though, the one and the only Jamie Church from the Farmington Chamber of Commerce, who is on the line. Jamie, good morning.
Good morning.
Thank you for calling in to be with us. And I wanted to have you on the program today because of the news that came out just yesterday from the governor's office. And we're going to hear more today, of course, when she has her briefing. But she kind of let us know a little bit about what the plans were to amend these public health orders this weekend to once again allow some in-house dining, inside dining at 25% capacity, and then also allowing more capacity in places of worship as well. And so I would say for you and your members, that's got to be good news.
Yes, absolutely. In fact, that indoor dining, kind of loosening the restrictions on that, is something we've all been waiting for over these last few weeks. I do want to remind your listeners that 25% indoor capacity is a wonderful step forward, but it is still imperative that we support these restaurants and that we remember, don't kind of sit back and go, oh, well, they can do the indoor dining again. And so, I don't have to go. Everybody's fine. Everything's getting back to normal. I mean, 25% is great, and it's such a great step in the right direction, but we still need to go and support these restaurants. And if they're full inside, which could happen at 25% capacity, please get takeout or utilize one of their outdoor spaces and continue to support these local restaurants. So
very good point.
That's my message.
Yes, and that's a great point because, again, it's 25%. It's not 100%. So, again, it's going to be less capacity. And again, we all need to keep doing what we have been doing to get the numbers where they are that have allowed this change to happen, which is another great thing. If we really want to go back to maybe higher capacities for indoor dining or send the kids back to school face-to-face or all those things that everyone wants to do, we kind of need to keep doing our part as a community to keep these numbers where they are.
Right, and the masks are still going to be required so that when you come into the restaurant, please have your mask on, and then as you go to your table, please wear your mask, and then, of course, obviously, while you're eating and drinking, you won't be required to wear it. But those are the things that are going to be in place for a while that we all need to be cooperative about and do so these restaurants can not just get to 25%, but then 50%, and then hopefully 75%.
Right.
We just want to see this trend continue, but this is great news. I mean, we've all been waiting for this with our chamber members and our restaurants in particular, so this is a good step.
Very much so. And, of course, again, the governor will be having a briefing this afternoon. We expect to hear more about this, more of the specifics perhaps, and I think there's supposed to be more released about schools in our state, and so that's coming up today at 3 o'clock. You have an event today as well, Jamie Church, from the Chamber that I wanted you to talk about briefly.
Yes, and this actually has to do with what's, schools right now and virtual schooling. We have a lunch and learn, which is something the Chamber's done off and on, and it's with ImageNet Consulting and also an independent educational consultant, Kathy Price. And the point of this is to give parents and employers even more tools in their toolbox right now, because we know that the virtual schooling and the online schooling has been challenging for employers and employees and families, and it's something new, and it's going to take some time to get used to that and how to best work around your work schedule and your kids' schedule and all of those things. So this will provide some very just practical information on IT needs that you might need in your home, or if you're an employer and you're really working with your employees and allowing them to work from home, what kind of IT things do they need in place? And things, about security to have in place. What is Zoom? How do you do Zoom? What are some of the other options out there if you're working remotely and also trying to homeschool your kids at the same time? And then Kathy will be a great resource on just talking about how to keep the communication lines open between the teachers and the students and the parents, as well as some of the issues with these the virtual schooling in rural areas where maybe they don't have all the broadband that they need to be Zooming in, as well as some of the schools and the families out on the reservation and the Navajo reservation that don't necessarily even have electricity in their homes. So some very important, I think, reminders of some of the challenges that people are looking at right now and how we as the chamber and we as a community can help support these families as they're doing this. So that's kind of what the Lunch and Learn. It's going to be an awful lot of information packed into, less than an hour, but we're going to do our best.
Okay. And so folks can find that by going to the Chamber of Commerce Facebook page. That's how you'll be sharing this?
Yes. So if you don't like our Facebook page, please do, because that's where we put all this information out. So it's Farmington Chamber Facebook page, and at noon, if you like the page, at noon, you're going to get a notification that pops up. The Farmington Chamber is going live. And then all you have to do is click on that, and you'll go right to the live event. And we do this in conjunction with San Juan Safe Communities Initiative. They really help us with these Facebook Lives because it is information that is helpful to everybody who listens in. So that is something, I really want to thank them for their help, because the technology part is something, the filming and all that is great that I don't have to worry about that. So
right.
Anyway, noon today, please tune in, and I think you will get some good information. And so that's today at noon.
Okay.
My little plug on that, yes.
No, very good. I like that. And, of course, again, to support the local restaurants, I know who have been struggling with following some of these public health orders and things like that as things kind of start to reopen a little bit this weekend. I think the amended orders start to take place on Saturday,
Yes.
To allow the inside dining at 25%. Of course, many, I think, will retain their outdoor patios that they have been constructing to allow that for folks who still want to get out and enjoy a meal together. But as you've mentioned, there's a lot of things that we can do, whether it's ordering takeout or going out to eat or following these public health orders to support these restaurants for one, and even all the other retail establishments too, right? I mean, that's what the Chamber's been preaching all summer.
Right. And so, just to follow these health guidelines, wearing the masks, doing the social distancing, standing apart, doing those things, it keeps us on this reopening trend. And that's my emphasis, because we, as the chamber, we want to keep everybody safe, but we want to see these businesses succeed through this. And we know we have some businesses that are on the edge right now, that if they can't start operating, I just don't know if they're going to be able to continue to be open. So we want to continue on this trend of seeing more, as you mentioned, houses of worship being able to go to 40%. And they're not a retail business, but that's health for people. That's wellness right there.
That's right.
People need that connection. And so, but for our retail spaces, the restaurants being able to reopen and seeing the retail be able to increase how many people can come in. And if we can just continue to see these trends with reopening, that I think puts us on the right track. Of course, I think we're all kind of waiting to see what happens in the winter when we go back into cold and flu season. But if we can get these preparations in place now, and if we can get these practices in place now, my hope is that then when we get back into cold and flu season, and if COVID does any kind of change or, resurgence, we've got these practices in place so we don't have to go backwards. We can continue to go forward. And that's what I want to see, is just let's continue to move forward on the reopening.
Very true. Well, and I know I will admit that I was off a little bit. I didn't think we'd see any changes until after Labor Day. I know the state was concerned about some of the numbers that had spiked after the holidays we had gone through, like Memorial Day and 4th of July. But here we are, and the governor yesterday in a statement said that, this is where the numbers are leading us, and so we can't back off on following these directives and following the guidance, as you mentioned. But I think it's all upon us with Labor Day coming up to still do what we're doing, which is following the health orders and keeping these things that have reopened open into September, and maybe more.
Exactly. Sorry, I just turned my fan on.
That's okay. That's perfect.
Did you hear that? I'm sorry.
We heard something, but we don't know what it is.
I know. Sorry, I move away from it.
A random noise.
I know. It's this random noise. Sorry, when you're multitasking, and
That's all right.
But anyway, I'm encouraged, and again, I'm sure the restaurants are very pleased to have seen this announcement, because I didn't expect it to, like you, I didn't expect it till after Labor Day. And I also think that we have to remember, too, these gradual openings are actually, for our restaurants, a good thing, because it takes time to get your staff back up, your inventory back up. So, you have to order food, obviously, for your inventory for a restaurant. So knowing, okay, now we're at 25%, and then anticipating for 50%, that does help, I think, in staffing and purchasing your inventory and being prepared. So, I know we want to all be back right to 100% indoor dining. I want that more, just as much as everybody. But I do think for the restaurants, it's good to sort of have these, little bit of step ups to hopefully full capacity soon.
That's true. Very good. Well, Jamie Church, I do appreciate your time this morning and always being available for us. Thank you so much for calling in.
Thank you. Thanks. And please tune in today at noon for the Facebook Live.
Yes, the Lunch and Learn, just at the Farmington Chamber of Commerce Facebook page, everybody. Perfect. Thank you, Jamie.
Great. Thank you.
You're welcome.
Bye. Have a good day.
You too. That's Jamie Church from the Farmington Chamber of Commerce joining me this morning on our community information program about COVID-19. Do want to share the numbers like we always do and some of the testing information that we are aware of from the New Mexico Department of Health. So let me get to those screens right now as I look and see what we're doing. But here are the tests for today, Thursday, August 27th, here at San Juan College this evening from 6 p.m. to 7 p.m. and then Friday, tomorrow morning, here at San Juan College, August 28th, from 7 a.m. to 8 a.m. Those are the next testing dates, free COVID-19 testing from the New Mexico Department of Health. And of course, you can go to registering at cvtestreg.nmhealth.org. That's cvtestreg.nmhealth.org to register ahead of time. And then when you get to the site, you are ready to go. You can also call 327-4461. That's area code 505-327-4461 if you need help getting registered for the COVID-19 testing here in San Juan County. Let's talk about the numbers. Again, we always start with Johns Hopkins. They have been tracking the numbers here across the world and here in the United States, of course. The latest numbers, of course, 5,823,923 cases in the United States. The deaths in the United States now 179,743. And so those are the latest numbers from Johns Hopkins, as you can see on the screen, as they calculate the numbers that are coming in from around the world. Then we go to New Mexico and the COVID-19 cases in New Mexico released by the Department of Health last night. This is coming from our website at ksje.com, but we always show you where the information is coming from cv.nmhealth.org. 69 new cases yesterday for a total in New Mexico of 24,535. 9 new cases here in San Juan County for a total of 3,158. There were 3 additional deaths in our state for a total of 750 now, but no additional deaths reported yesterday in San Juan County. And there's now 241 additional recoveries in our state, which is notable, at 11,909 recoveries. Again, the stories that we have compiled, talking about the Navajo Nation numbers again, 14 new cases on the reservation yesterday for a total of 9,597 cases. 4 additional deaths were reported yesterday as well. That's now at 498 from the Navajo Nation. But again, compared to where the Navajo Nation was just a few weeks ago, these numbers are much improved. There's the other story about the dine-in restaurant service and higher church occupancy beginning on Saturday, as we've been talking with Jamie Church about. So again, that is a big change. And the governor, again, will be coming on online this afternoon. It's supposed to start at 3 o'clock to update us on these public health order changes, which would include maybe some other news about back to school. And so I know a lot of folks will be watching that. We'll update the website accordingly with whatever news comes out of that press conference this afternoon. And there, of course, are the New Mexico stats as well. So that's some of the other things that we are watching and covering for you this morning. San Juan County, of course, always compiling on a weekly basis some of the numbers that are coming in from the state, the Navajo Nation, and San Juan County, so we can share that with you up through about the 23rd of August, which would be last week. And you can see the red line there, the top line on the screen is the state of New Mexico cases. You can see how the dramatic drop-off in cases across our state, which is excellent news. And again, I think that is what's driving some of these decisions by the governor to amend these public health orders. The Navajo Nation number in green is again showing that downward trend, and these are averages. So again, it kind of gets us away from the daily numbers to kind of see how things look over time. And the blue line is San Juan County COVID-19 cases, and again, the county is also on a downward trend, and that is encouraging news as well. As we look at the next screen from San Juan County's cases are broken out even more. The yellow line are the numbers of San Juan County cases, again, the averages, and again, that number continues to kind of drop. It's kind of straightening out just a little bit last few weeks, but still on a downward trend. And certainly the blue line there are the COVID-19 deaths in San Juan County, and those continue to be fairly low, which is encouraging as well. We like to see that as well. So those are the latest information. Again, we thank San Juan County for compiling these numbers for us every week and allowing us to share them with you on this program. Now, next guest is Dr. Erin Philpott. I spoke with her yesterday afternoon to get an update on some of the issues that are facing she and her colleagues at San Juan Regional Medical Center, and much, much more about treatments. Joining me now to talk a little bit about COVID-19, of course, and conditions here in San Juan County from San Juan Regional Medical Center. Dr. Erin Philpott is joining me on the phone this morning. Dr. Philpott, good morning.
Good morning, Scott. Thanks for having me today.
You bet. Thank you for calling in. And I have to say to the audience and to you that Megan Cullip is not available to be here for our interview. We're speaking on Wednesday, and I know she's just mortified that she is missing this opportunity to speak with you. So I just want to put that out there. So she's sorry she can't be here, but I am, and you've got some great information to share with us. So I appreciate you calling in and being part of the program. We wanted to talk a little bit about the news that's been reported this week about the treatment of COVID using convalescent plasma. I know we've talked with you about that before, but what's your latest take on some of these latest developments?
Yeah. Well, first off, thanks for having me
of course.
Again, and I'm sorry to miss Megan. So as far as the convalescent plasma goes, as you remember, it's sort of the liquid portion of the blood, and it is taken or donated from patients who have recovered from coronavirus or SARS-CoV-2. Within this liquid portion, there's antibodies that are thought to help neutralize the virus when given to people who are actively or acutely ill with SARS-CoV-2. It's something that's been well studied and utilized since the turn of the century, and I think actually even during the 1918 flu pandemic, if I'm not mistaken, and has been studied in different ways across our country since the start of the COVID-19 pandemic here. The program that we at San Juan Regional were or are, as of I think one more day participating in, is the Expanded Access Program through the Mayo Clinic. it gets very confusing, all these different programs, whether it be studies or programs to access medications or, FDA approval formally or the emergency use authorization. But to date, we were participating in this expanded access program. As everyone's probably heard or is hearing now, that convalescent plasma has received emergency use authorization through the FDA. So that just means that it has not undergone the usual rigorous FDA sort of screening and assessment process with the normal robust data that is required to get approval of a treatment, but that it was approved considering the risk benefits and probable benefit in coronavirus. So that is going to change things just a little bit for us. There's some arguments that maybe the data is not robust enough quite yet. We haven't seen any really great randomized controlled trials looking at convalescent plasma. The Mayo Clinic expanded access trial did manage to enroll. It was a really great turnout, enroll many, many, many people across the country, and did get some good data from that showing that there is mortality benefit. But again, it's not that usual sort of gold standard randomized controlled trial that we as scientists and physicians so like to see, on which we can base our evidence-based practice of medicine. So more to come on that, but that's where convalescent plasma is at this point in time.
Understood. But it does seem like, at least in some cases, it seems to be a fairly effective part of the treatment process, maybe not the whole treatment process, but at least part of it. Is that your understanding?
Yeah, that's exactly right, Scott. A big thing in understanding coronavirus treatment or the therapeutics for coronavirus is the appropriate timing and the appropriate patient. So there's all these different diagrams and sort of general understanding of how the course of COVID goes. And people, you're in your viral replication phase and feeling unwell, and then you kind of get into this inflammatory phase, and then this convalescent phase, and then even a secondary inflammatory phase, which we've certainly seen at our hospital and others are describing around the country. And for convalescent plasma and remdesivir, it seems that the earlier in the treatment, as you can imagine, if you can halt that viral replication and prevent that patient from ever getting into that pro-inflammatory phase, the better. So the data is looking like patients who are maybe with severe coronavirus infection, meaning they're maybe in the hospital and on oxygen, but not to the point that they're needing respiratory support through a high-flow nasal cannula or on non-invasive ventilation or even ventilated or on ECMO, that the patients who are a little bit earlier in their illness probably benefit the most from convalescent plasma.
I got it. Thank you very much for explaining that to us. And Dr. Philpott, I wanted to ask you, too, about some of the long-term effects of COVID, as we're hearing more about patients who have come down with this and recovered, which is great, and we're all thrilled. But many of these patients still have other long-term health impacts from dealing with COVID. They're not maybe 100% like they were maybe before catching the virus. Is that something that we're still hearing about?
Yes, we are, Scott. That's exactly right. And I think that's the most concerning thing about it. In fact, I was just talking to a friend the other day who had coronavirus early in March, and he said, yeah, I was sick for a week and a half, but I still feel bad, like not back to his usual exercise tolerance. And he's a young, healthy guy in his 30s. And we're really seeing that across the board. So even people with mild or moderate illness, so never make it to the hospital, are experiencing some of these long-term ramifications of the virus. We don't know what exactly yet. There's been some very interesting cases that we've discussed. I work with our COVID to Home team, they're called, and
right.
I think we've had Rebecca French on before and talked to that group as well. But it's very interesting as well as very concerning what some of these patients are experiencing weeks to months after having COVID-19 infections. And again, these people aren't the ones necessarily that were in the hospital and on the ventilator, but they're people who just, stay home and worked their way through the illness but are still dealing with stuff. We are waiting. We've talked a lot about establishing a multidisciplinary clinic to help support some of these folks who have recovered from COVID-19 but are still having various symptoms. And we just don't have enough data yet to say we should get pulmonary function tests on these people, or we should get echocardiograms at these routine intervals, or repeat CAT scans. There's some general guidelines out there on how to work these folks up, but really it's just still evolving, and we're yet to see kind of what is going to be the most helpful to folks who have recovered from coronavirus but are still experiencing significant shortness of breath, or chest pain, or confusion. There's been a lot of delirium or prolonged delirium cases. There's been some interesting recurrent lymphadenopathy, or enlarged painful lymph nodes, which to me suggests kind of an autoimmune process. So I think, it's an absolutely fascinating virus, but I'm so hopeful that we're going to figure out treatments and really nail down what it's doing. But to date, we just don't have all the data and info yet.
Right. And that leads me to my next question, Dr. Philpott, which would be the work on the vaccines. And I know it is something probably that you're reading through the medical journals and things like that. We have a lot of companies, a lot of countries around the world that are working feverishly to try to find an effective vaccine, and some are in some trial stages now with groups of people. What are you hearing in your circles, and your optimism for some good treatments here soon, or in the next 6 months? I don't know.
Yeah, I think, there's a lot of great stuff going on out there. Scientists have really stepped up, and governments and have organized this to happen at breakneck speed. I think, our state, who's been extremely, organized and coordinated with their various groups and expert teams throughout this whole pandemic, is starting to look at that and talk about that and understand how the vaccine will be distributed, how many vaccines the state of New Mexico may be allocated, and how we can go about a systematic distribution of the vaccine to those at highest risk and highest need. So I do have confidence that that's going to happen in a great or very productive, optimal sort of way. As far as the timeline, I've heard various things. There are several in phase 3 trials right now, which hopefully will come out sometime in early 2021. So we'll see on that front. I think the one thing worth pointing out is, there's phase 1, phase 2, phase 3, the phase 1, phase 2. There are rigorous standards required to complete phase 1, phase 2 trials for vaccines. And I think it's important for the public to know that there were no corners cut on that. And I think, it will be interesting to see what our population decides to do, both with the coronavirus vaccine as well even as the flu vaccine this season. I would, a person having watched people die from this for months now, I would not hesitate to get a vaccine for myself, my parents, my children. I think, it is up to our scientific community to ensure its safety at this point in time, and I have confidence that we're going to come through on that. But I know, people have various beliefs and understandings, and news sources even, and so I just am hopeful that the American public will really try and look at it objectively from reliable sources, and do the right thing for themselves and their families, whatever that might be.
Sure. Well, and again, with all the testing that's being done, we are fairly confident that the system is in place to produce this safe and effective vaccine once it's released to the public, as you mentioned. You mentioned the flu vaccine, Dr. Philpott. I know flu season is approaching, and so I imagine that has to have folks in your line of work just kind of holding your breath to wonder how bad it's going to be, or maybe it won't be as bad since we're now all washing our hands and staying away from each other and 6 feet apart and wearing masks. So I don't know if we're going to have a good flu season, a bad flu season, but one thing's for sure, the advice is still to get a flu vaccine, right?
Yes, that's absolutely right, Scott. And I think this is a really fascinating topic of discussion that we can talk about and speculate about, 24 hours a day till flu season starts. We just don't know what's going to happen. But what we do know is that the flu vaccine significantly impacts flu cases, hospitalizations, and deaths. And I think that is the most important thing for everyone to understand when we talked about flattening the curve a lot with coronavirus. And that the essence of that is that we reduce the number of cases or people that require hospitalization as not to overwhelm our healthcare infrastructure and have unnecessary mortality or people dying that otherwise wouldn't have died if they had medical care accessible. Our hospitals across, depending on the severity of the flu season, are stretched across our country normally. So if we have a bad flu season plus coronavirus, I have a hard time even thinking about it. Honestly, it's just overwhelming. Just envisioning the sadness and what we're going to have to go through. So I think this year, this year of all years is the most important year to get a flu vaccine. I personally had neglected to do it promptly one year, and one of my children got flu A when he was 4 and ended up at Children's Hospital with a rare complication. And, I think all of us do that. It just is not on the top of our list sometimes to get in and get that done. And I think it must be this year. I think it's going to be even more challenging for people to get it in a convenient way because we're not seeing as many in-person clinic visits. They've seen that over the few months, I think it was March into June, that actually pediatric vaccinations went down 20% just because you weren't incidentally bringing your kid into clinic or you weren't scheduling that well child visit. And I think we may see the same thing with flu vaccines. If you don't get in to get that ankle checked out and just kind of incidentally grab your flu vaccine while you're seeing your doctor, you may not get it at all. I think there's speculation that some older folks who need it the most are a little bit nervous about leaving their house and going to a pharmacy where they normally get it or their doctor's office as well. And therefore may not get it. There's some interesting data, actually, and a lot of recent publications on this. The Southern Hemisphere is actually having a more mild flu season, which is interesting. And we don't know if it's just truly a mild flu season, if it is more mild because people are doing rigorous, social distancing, mask wearing, hand hygiene, et cetera, measures. Or we don't know if people are just kind of getting lost in the shuffle of COVID and they actually have flu. So I think we're still waiting with bated breath to see what happens with that, and hopefully we'll have that same reflection here in our flu season. There is some interesting data out. It's still preprint, so it's not been fully vetted and looked at by scientists and for its completeness and proper evaluation, but there is some newer data that shows that a physician or scientist went back and looked at people who had gotten the flu vaccine over this past season and actually found that the morbidity and mortality was lower with COVID-19. So I think that's super interesting. And correlation is not causation, so we don't know if that's truly the effect of the flu vaccine itself, or if it's some other factors that are at play there. But I thought that was a pretty compelling piece that I look forward to reading after it's fully vetted to see if truly that is a cause of reduced morbidity and mortality with coronavirus. So lots to say on that. Our hospital is currently working with the Department of Health as well as our community. We're going to put out a survey, or we recently put it out to all the different pharmacies and doctor's office just to see who's doing their usual flu vaccine clinic. We are going to come up with a strategy so people feel safe so they can come through the drive-thru and get their vaccine. And we are hopeful we'll get a good turnout because really I think even just a number that's commonly cited recently, the 2017-2018 flu season had a relatively low vaccine match. It was about 38%, and it was thought to have prevented 7.1 million illnesses from flu, 3.7 million medical visits, and nearly 110 hospitalizations and 8,000 deaths. So even a bad match season, the flu vaccine really really affect morbidity, mortality, and help, in that sense, flatten the curve to not overwhelm us.
Right. Well, Dr. Philpott, I appreciate the information, of course, and again, the whole idea to not overwhelm our hospitals and our healthcare workers, even with COVID or flu or whatever we're talking about. This is, again, another way that we can kind of take responsibility for our own healthcare by getting a flu vaccine and not having to come and see people like you and your colleagues at the hospital if we have flu symptoms. But if we have the shot, as you just mentioned, that can help alleviate a lot of these cases, even in a bad year with a match. So I appreciate your time this week, Dr. Philpott. Again, thank you so much.
Yeah, thank you so much, Scott. Have a great.
You too. Have a great afternoon. Dr. Erin Philpott, San Juan Regional Medical Center, our guests here on KSJE. We so appreciate Dr. Philpott and all of our guests from San Juan Regional Medical Center providing some good local information on this program with KSJE, and thank you for tuning in as well, everybody. We also thank our partner radio station, KNMI, Vertical Radio 88.9. They air this program every day at noon on Mondays and Thursdays, and of course you can hear this again on the radio on KSJE Radio every afternoon at 5:06 p.m. here on KSJE and KSJE.com. So before I go, again, Megan Cullip will be back with us on Monday, so please join us for that. Reminder again about the amendments to the public health order announced by the governor yesterday, and again, we expect to get more details this afternoon. But again, houses of worship operating inside at 40% of their maximum capacity. That's an increase up from 25%. And indoor dining now at 25% of maximum capacity, in addition to the outdoor dining facilities for restaurants. Those changes go into effect on Saturday. Again, we expect more information from the governor this afternoon. Her briefing is expected to start at 3 p.m., carried on her Facebook page from the governor's office. And we'll be back, of course, on Monday with an update on whatever the governor has to say and much, much more. It is local information. We provide it here on KSJE. So thank you for joining me, everyone. Have a safe Thursday and a great rest of your week. We'll talk again on Monday.